get started. Dr. Chan should be here, so I think she'll be a little bit late, but that's okay. All right, I will officially call this meeting to order at 8:33 a.m. and start with the roll call. Vice President Salt.
Here.
Commissioner Geithner.
Here.
Commissioner Nelson.
Here.
Mayor Dixon.
Present.
Councilman Donaldson.
Here.
Dr. Chan is not here, but she will be at some point. We'll update for the record when she arrives. Mrs. Ralston.
Here.
Dr. Vu.
I'm here.
And President Barnett, I'm here. We'll move on to approval of the agenda. I need a motion and a second, please.
Were there any corrections or anything?
No, not
No
at this time.
corrections. I'll move to approve the agenda then.
Okay. Do you have a second? All in favor?
Aye.
All opposed? Motion passes. Thank you. We will now move to Board of Health comments, and we can just go around the room. So, Dr. Vu, you want to kick us off and just say your name, and you can go around the room.
Rick Vu, no comment. Thank you.
Carrie Geithner, I'm Paso County Commissioner, and I don't think I have any comments at this time. Actually, I do have a comment. Sorry, I was not prepared in my brain yet. Still early, guys. I just wanted to kind of make a statement about something that happened recently in the federal government that I think has implications for here. Two things, really. One is, I hope you all saw there was some news articles about changes at the EPA related to public health specifically and climate change, and the kind of reassessing what the impacts are of greenhouse gases. So that was a very interesting read if you haven't read that. That I think potentially has some impact in the way, or at least our state will be talking about things in the future. Also, gosh, just slipped out of my mind, guys. It's too early in the morning for this. There was one other thing. Oh, I think that it's important for us to be aware of and potentially consider the conversation that is happening right now at the state level around joining WHO. I'm personally very concerned about this because I think it's an attempt to distance ourselves from our federal government and some of the things that are happening there. And so I think that there are some implications for things that may be passed down through the state and how we interact with the state. And so just if you weren't aware of that, that is something that is happening, and I think it's important for us to be aware of and potentially discuss what our response to that might be.
Thank you.
Mayor Dixon, and at a state level, I'm very concerned about the proposed bill to decriminalize prostitution and the potential impact it could have on public health. So we're watching that one closely.
Great, thank you.
Doris Ralston, no comment.
Vice President Salt, good morning, everyone. Monday, President Barnett said, I think we need to take the energy of the USA hockey win and bottle it up and have a little sip every day. And I've been trying to bring that energy to my days. So I would encourage all of you. It's great to be an American. We took away some great medals, and I'm really proud of our country and what we represented at the Olympics this year. So good morning.
Thank you, Vice President Salt. We did not coordinate this, but you stole most of what I was going to say, which is I want to connect public health and wellness and translate that into the athletic achievement of the last couple of weeks of Team USA across all of our Olympians. It was so much fun to watch. I hope you all got to watch some of it. I watched a lot of it, particularly the men and women's hockey team. So just on behalf of the entire Board of Health, since this is Olympic City, USA, just want to extend a very heartfelt congratulations to all of our Olympians, whether you won or not, but especially if you did win a medal. No, just kidding. But just kudos to all of you, and thank you for all that you do and for all the inspiration that you provide. Moving on.
No comment from me,
Okay.
thank you.
Yeah, no comments.
Great.
No comments.
Great. Okay, thank you all. So we will now move to approval of the minutes. As usual, need a motion and a second. And if there were any changes that folks notice that need to happen, we'll entertain that now.
I move to approve the minutes from our last Board of Health meeting in January 28th.
Mayor Dixon, I'll second.
All those in favor, say aye.
Aye.
All opposed? Motion passes unanimously. Thank you. And for the attendance record, it looks like Dr. Chan has joined us online. Okay. Public comment on items not scheduled on the agenda. Is there anyone in the room? No. So I have an update for folks, both online and in the room, and I'm going to read it to make sure I get it right. So we have an update on our public comment process to ensure consistency with county procedures and improve meeting efficiency. El Paso County Public Health will be transitioning away from virtual public comment during public meetings. This change aligns with the approach taken by the Board of County Commissioners and supports a streamlined, transparent process for public input. The updated process will take effect on Wednesday, March 18th of this year. Multiple options for providing input will remain available, including in-person comments during meetings and email submissions to our email address, Board of Health, all one word, at elpasoco.com. ADA accommodations can also be requested in advance. Following today's meeting, we will post an announcement on our website to provide 1 month of advance notice before implementation. We want to make sure the public has clear information and adequate time to plan. So again, we're not moving away from public comment. We are moving away from the virtual option, which aligns with what our county commissioners have recently implemented. Everyone clear? Any questions or comments, concerns?
Yeah.
Councilman Donaldson?
Yeah. You know, and City Council's experimenting with this right now. We may go back to allowing public comment online. And the reason to think twice about this is people get sick. They
Yeah.
plan to be here and speak. And so that would give them the opportunity. They have children. They have jobs where it's difficult to make it here and then make it to their job. But they do want to speak in person, because when that happens, they know that we all hear it. When they send an email, oftentimes they don't get responses from all council members or all board members. So I haven't seen it be burdensome for the board here. I think there's reason to consider keeping it, just to offer that opportunity to citizens. You know, some citizens, you mentioned ADA accommodations, but I don't know if anyone else on the board has a similar thought.
Commissioner Geithner? And then we'll go to Mayor
Well,
Dixon.
I'll just share a bit of the decision-making process that we did at the county and why we've made this decision. Part of it does have to do with technical limitations, and also we just found that it can be very disruptive to meetings, and we sometimes have struggles with that technology. And that was really only instituted as a result of COVID, when people were not allowed to come into the building. And so we're going back to pre-COVID. We're not going to keep in the same place. There's some things that will stay around forever, an increase in technology for sure. But we do have all of those other ways here as well. But we do have them on the commission. Can't speak to how things run at the city, but we not only, all of our constituents get replies. We have someone that makes sure that that commissioners are supported in their emails, so that if they're very busy, that constituents still get replies. They get forwarded to the right place. They get, connected to with what they need to do. So, the processes of public outreach and communication, I just think, are changing as the times change, and it was just an evaluation. So we have not had anyone who was not able to. Primarily, we get most of our public comments, again, a little different at the city, but we get most of the comments at the county and for land use hearings and things like that, and those are required to be in the packets that all commissioners read before the board meeting. So just a little bit of a difference in how we operate, perhaps, but ultimately there is no reason that any constituent cannot have their voice heard, whether it's in a meeting or out. I think there's some antiquated understanding, and again, maybe it's different in different areas, but that the only time that you can reach out is during a board meeting, and we're trying to encourage people that that's not the only time you can reach out to people on a board or elected officials. You can reach out anytime and have those interactions. You don't have to wait for one of those. You don't have have to take time off work. And so continuing to make sure that they have the ability to interact in that way. So just want to give you some understanding of why we moved towards that. Like I said, a lot to do with technology, a lot to do with we're not in the COVID time period, and we have many other options at this point.
Great, thank you. We'll go to Mayor Dixon and then Mrs. Ralston.
Yeah, at least up where we're at, with all the out-of-town property owners, we're getting pushed pretty hard to maintain and actually maybe even expand basically the team's capability is what we're using now. It does provide access for people who otherwise would not be able to be there. So we may want to kind of keep a little bit of a open mind to kind of see how this goes, to see if we get a lot of pushback and the rationales behind the pushback.
And I was going to add to that and to your comment, let's see how it goes. And if things start blowing up and we need to re-implement it, we can absolutely reconsider that. So we can, let's move on to Mrs. Ralston first.
So Commissioner Geithner, how long has the county been doing this new process? And have you had any negative pushback?
Since January, and no, we haven't.
Commissioner Nelson?
Since I've been here, I don't think we've had a single online public comment, and I joined in August or July. So just, to me, the demand doesn't seem to be there, if we're going to look at that signal as well.
We'll have one more comment. Go ahead.
Yeah. And we also, I think, since you've joined, haven't had any citizen comment. Maybe we've had one. But there will be issues that come up, guaranteed, over the next few years that will draw public interest. So I would recommend that we keep this. It's not really used right now. No one's calling in. It's not a burden to us. And if we are going to change the policy, I would ask that we have a vote on it.
So we can consider that. I don't think we need to have a vote on it. I think this is a staff-directed issue. Deanne, go ahead.
Yes, I can speak to this. This is a suggestion that I made for the board, in part because we have not received a high degree of interest in our virtual public comments. There is an amount of logistical support required from our team to be able to be monitoring for those. And we have options for the Board of Health email as a way where we are ensuring that comments go to the board and that people do receive a response if they reach out to us. So from a staff perspective, it felt like we were at a stage where it made sense to transition away from something that we are monitoring but are not seeing utilized as a way for us to focus our efforts and still provide opportunities to engage while providing public notice so that the transition could be communicated to the public first. So those are some of the conversations that we've had internally as staff about how we can be more efficient in supporting board meetings and coordination of efforts leading to the meetings.
Okay. So I go ahead.
Add one thing to that. I want to say, first of all, at the county, and I'm assuming that it is here, but I'm sure the attorney could clarify, it's a discretion of the chair. It's not a board decision. So I'm not sure that a vote's appropriate if it's the discretion of the chair. That's up to you, or the attorneys are saying whether or not that's the case here. Second of all, I want to say thank you to Deanne and Hunter for working to align with county policies. It's something that's been a frustration over a period of years that we haven't always been aligned, but we're connected. And so we have asked and shared amongst all of the county departments and all the county boards that this is the procedure that we're using. The idea is to help streamline and for citizens to have clear whenever they contact the county that our policies are similar. That's, again, I still think it's the discretion of the chair. Our attorney could correct me if I'm wrong on that. But I just want to thank you for being forward-leaning on that and working to align with the county and being part of the county, because I do think that is helpful to citizens overall to have a consistent approach so that it's not unclear to them. People don't see a delineation. They don't mostly know that we even have a separate board. They see El Paso County Public Health, and they assume that there are, similar rules with El Paso County. So I just want to thank you and say that that is actually something that we are really happy to see public health working very closely with the county as a whole.
Okay. Thank you, Commissioner Geithner. Councilman Donaldson, I do want to move on. We are going to move forward with the changes. I do want to
Excuse me,
note.
President. I do have a comment,
Okay, go ahead, Dr. Jan. Sorry, I didn't see you on.
a comment and probably a question. If somebody contacts the department or the board before the meeting and indicates that they would like to attend virtually, would they have the avenue to do that with advance notice?
Go ahead, Deanne.
So I'd be happy to speak to that. Under ADA, if we have an ADA-related request for accommodations to support their request, we will work through that process to provide access under ADA. So we haven't encountered that, so I cannot tell you right now exactly what that would look like, because it would be somewhat contextual, but we will certainly make available accommodations.
Okay, and then the other question that I have has to do with the public nature of the comment. If somebody is has a question or a comment for the board but is unable to attend the meeting, will their comment, I mean, I realize that they're going to get an answer, but will their comment be read into the public record at the time of our board meeting?
What have we done in the past?
So when we receive emails, those typically go to the board members via our email process. I would be happy to explore what that would look like and look at requests to have their messages read. We have not encountered that to date, but we could certainly consider that.
Okay, thank you.
Okay, thank you all for this.
If I could
w-
make one
really
last comment.
Last comment, and then we're going to move on. Go ahead.
Yeah, I think if, the last thing we should do is limit the public's access to comment on items before the board or to bring their thoughts to us. I don't, now I'd want to hear from Deanne if we're going to make a decision to do this in the future, just how burdensome it is. I don't think we've had any information on that yet. Citizens do get responses to their emails, but it can be from staff, and a lot of times it's sort of a form letter response that they get. And they don't know that everyone has really heard what they've tried to convey, because you can reply thank you to an email pretty quickly. When they speak, it's a different thing. And again, I just think the last thing we should do is try to decrease ways that our citizens have to communicate with us. Currently, nobody's really doing that, but there's not a public health issue like there was during COVID. And we found out things during COVID with citizen comment and the way our emails were coming to us. So, you know, my view is that we should maintain the ability for citizens to call in during citizen comment. Thank you.
Okay, thank you for that. We are going to move on. The discussion has been noted. The policy is not going to change. I don't view this as decreasing access. It is a deprioritization given discussion that Vice President Salt and I have had with staff. And I'm all for exactly what you just said. How can we work better together? What burdens can we take off of staff? And my commitment to you and to the whole board and to the public is if there is an extraordinary need to have access via this channel, by all means, we will turn it on. We will use it. As for the emails, in my time on the board, I have never seen a thank you, got it, moving on response, ever. And so directly to staff, thank you for your email responses, your thoughtful responses, and for keeping us all in the loop on those responses. So you may have seen that in the past. I have not. So we're going to move on.
Well,
we're going
if
to
I
move
could
on.
just respond to that, because you,
Councilman Donaldson, I understand. We can discuss this later if we need to, but I think we have everything we need for this conversation right now.
what I would say is that although the staff sends back a very good and thorough email, that doesn't reassure the citizens that the board members have read their email. It's different when they get to speak to us directly.
Okay, I hear you. I would ask that all the board members ensure they read their email like you've been asked to before. Okay, let's move on, please. So let's move to new business, chronic disease update, and board liaisons discussion. Deisha Hudson is going to lead us in this.
Good morning. Daisha Hudson, Community Health Promotion Division Director. You may remember that in January, we began phase 1 of the chronic disease prevention pilot. This pilot is a non-competitive funding opportunity that we've been given to assess and build long-term chronic disease prevention infrastructure here in El Paso County, with the main focus of phase 1 being really the assessment and building our agency capacity and beginning to educate staff and our community partners on chronic disease prevention practices. The purpose of today's meeting is to provide a brief update on where we are at with our chronic disease community assessment, and then to determine which board members would like to serve as liaisons as we move forward in the process. So our internal work group has been established and meeting regularly to complete the first step of the chronic disease community assessment process, which is really looking at our agency readiness and using the assessment tool and key metrics that were determined by the work group. They have reviewed and scored 19 evidence-based strategies. And really, the assessment tool took us through a series of questions and prompts that helps us look at feasibility, capacity, support, and agency fit with each of these strategies. We are ready to meaningfully engage with the board as we move forward with strategy selection and in preparation of phase 2 that will begin in July. Engaging with the board through this process is going to provide an opportunity for early awareness, meaningful input, and alignment. Board of Health liaisons will be able to help identify priority strategies for chronic disease prevention that align with our organizational goals, our funding requirements, and the community needs. Given the consideration of the Sunshine Law and any potential scheduling conflicts, we are proposing 1 to 2 Board of Health members serve as liaisons. We have identified 4 key areas where Board of Health liaisons can support and inform the process. And we have tentatively scheduled the related meetings, each planned for 1 hour. And to make the most of our time, we are committed to provide information and materials in advance of those meetings. So you'll see here, we have dates and times scheduled, but we can absolutely adjust these as needed. But we're really looking, like I said, 4 key areas that we're wanting to collaborate with the board. The first being reviewing the readiness assessment data that we have completed so far and looking at the rationale for the top 5 strategies that have clearly risen to the top, but wanting to engage and get feedback from the board. And then the second meeting would be to review the additional data that we collect. So once we pick those top 5 strategies, we want to collect more local and state data to help inform that. And then we'll be looking for feedback on who in the community do we want to involve in the process and the conversation. And then the third meeting would really be to review a summary report after we've met with the community and selected those top 3 strategies. And then the final meeting would be to really give an opportunity to provide feedback and an overview of the entire summary report of the entire 6-month assessment process. So for next steps in discussion, really just want to open it up to identify who on the board would like to serve as a Board of Health liaison, and then once we have that identified, we can work with Amanda to adjust any of the dates and times needed for the meetings. And I'm happy to answer any questions.
Thank you, Deisha. So let's start with questions. Does the board have any questions or comments about the work, the time commitment? Just to be clear, ideally, this is in person here. So not virtually. Just so everyone knows, we had a discussion on where you started, and for everyone involved, not getting into 3 or more and what that would trigger, we do want to keep it at 1 or 2 board members. So Go ahead.
And this is a staff-directed thing. The board is not coming with authority. We're just liaisons from the board to the staff. So how many, approximately, how many staff members, because it's kind of you and Summer, both of your departments are working together on this. So approximately, how many staff are going to be part of that?
We have approximately 8, I would say.
Fantastic.
Yeah, 8 to 9.
So this is staff-led. We're just
Cross
there
divisions.
to just kind of, hey, is this something the board has talked about? We kind of all know, we all have a lot of similar questions, so we can kind of bring those ahead of time, and updates will still come to the board. But this is a staff-led, and they have asked for our input and being involved in the process, and so that's why we're doing it this way.
Commissioner Nelson.
I have a question. Can you speak a little bit more about the agency readiness assessment and what that, just give me more context.
Sure. So the state provided us with the evidence-based strategies. So there were 19 strategies and they provided an assessment tool. And so that assessment tool took us through a series of questions. So we look at each strategy, and we're looking at, based on the prompts. And then we also came up, because we wanted to make sure that as a team that we were looking at it through the same lens. And so we kind of came up with we did come up with our own scoring metrics as well, so that we were approaching it from in the same way. So each of those strategies, we went through a series of questions to assess, is this something feasible? Is this something that we have capacity as an agency to do currently? Do we have capacity with additional funding? Different scenarios like that. Is there need for this in the community? So data and analytics is also part of the internal work group, and so they're simultaneously providing data and information that they have about each strategy to, is there a disparity in our community? Is this a big problem? Do we already have a program working on this? Is this maybe something that we're already working on this, so we can focus our efforts on something else?
So what came from the state was sort of a guideline of, here are 19 strategies to address chronic disease. Mm-hmm. And so that was sort of your compass, I guess.
Yes.
And then evaluating what the needs are actually in our own community, and then what our department actually is capable of fulfilling and maybe already fulfilling. Is that a good summary?
And then, the needs of the community.
Yeah, okay. Can you give me an example of what one of the categories is?
I brought it because I thought it might come up.
And as you pull that up, can we go back to the dates slide? There we go. Thank you. Okay, go ahead.
So let's see. There's different themes too. And there's 25 strategies altogether. The first 6 strategies are what are considered foundational strategies, and that's like our main deliverables for this phase 1. So the education and completing the assessment, and but I will give you an example here. And this is strategy 9, tobacco alignment. Coordinate with those working on the local public health agency Colorado Tobacco Framework to align efforts for chronic disease prevention. So this was an area that scored really high because there's a need, but we also already have a program and funding and staff dedicated to this effort. And so that was part of the considerations. And then through this framework, they provide us with activities, suggested approaches and activities or actions that could be taken for each strategy. And so we looked at that through, is this something we're already engaged in? Is this something we lead? Is this something we're interested in being a part of and feel like we have capacity? And so taking each strategy, looking at the approaches that were provided in the framework and seeing how we as an agency, El Paso County Public Health, could fit into that or not. And I don't know if that is like the best examples.
Yeah, no, that's great. Can we maybe just get a copy of that 19 strategies? I'm just curious what the state is saying will help with chronic disease, and so that I can be familiar with where you all are working from.
Absolutely. And I will say that most of these strategies, like when we're talking about like the three main behaviors that contribute to chronic disease is physical activity, nutrition, tobacco, but also, you know, there's clinical strategies in here, diabetes is in here, cardiovascular health. So,
Okay,
but
great.
yeah, happy to provide.
Thank you.
Yeah.
Do you want to go next? And Dr. Chan, I see your hands up. Let's let Deanne respond real quick, and we'll go to you.
Thank you. Daisha actually spoke to what I was going to
Okay,
add
great.
regarding the variety.
Great. Dr. Chan, go ahead.
Yeah, I think my question is to try to figure out how we got these strategies. Did the state already provide the burden of disease in chronic diseases disaggregated by county before coming up with these strategies and handing them to the local health departments?
So they didn't provide us with any specific data, but these are evidence-based strategies that are meant to prevent chronic disease. And so we are given the opportunity through this assessment process, which is what we're going to be doing over the next month, is taking the top 5 strategies that we discussed with the board and really collecting a lot more data, local data, on those strategies to inform how we move forward or not with those. So we have an opportunity to collect and really assess our local data and how it fits with the strategies that we are proposing to move forward with.
Okay, so the strategies are going to be universally applicable no matter what the actual chronic disease process that we're addressing. And then we're going to determine our burden of disease and then apply these general strategies to the diseases that we identify as probably most impactful or highest need. Is that correct?
That's correct. And I think where we can, you know, localize this is how we implement the strategies. So they provide the strategy, but we can determine how we implement based on the data that we have, the needs of the community, and how we can operationalize it as an agency.
Okay, perfect. Thank you.
You're welcome.
We'll go to Dr. Vu and then Mayor Dixon. Go ahead.
I'm just curious, do you think our staff has capacity to do additional work if we don't get additional funding?
So we actually did just find out that there will be additional funding tied to this in phase 2. So we're really pleased. It's a substantial amount of money, roughly $750,000 to for the implementation phase. And so really exciting. We would be the highest funded county in the state given our population, and we'll be required to work on at least 3 strategies. So it's really exciting.
Yeah.
Thank you.
Mayor Dixon.
Do you have an estimate on the amount of time it may take outside the meetings? In other words, are we reviewing volumes, or are we just, you know, small packages?
That's a really good question, and I think with the prep and providing the information ahead of time, you know, I wouldn't imagine it being more than 1 to 2 hours. That may even be too much. It's hard to say, like, how deep you want to go into review, but we're planning to provide the information ahead and then give a thorough overview at the meeting.
Okay.
And Mayor Dixon, we actually did talk about that specifically, and the goal is exactly what Daisha just said.
Beautiful.
Use everyone's time wisely, ours, staff's. When we're together, whoever it is, let's boom, 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 knock things out, really make progress while we're together. So that's the plan.
Okay, thank you.
Commissioner Geithner.
I'll just say this is really exciting. So I'm glad to see that you're excited about it too. I know we've had a lot of talk about chronic disease, so I think it's such a great opportunity. So I don't know if you're ready for this not, but I would like an opportunity to be a liaison. I think it would be super great to get to know a lot of the staff, so that's really exciting. And I know that there's a lot of I really appreciate our volunteer board members, and I know that there's already a lot of extra meetings that we're having. So I'm happy to serve in this capacity if the chair desires.
Absolutely. You have one?
I just looked
Go
at
ahead,
my
Mayor Dixon.
calendar, and it looks like I am available.
Okay.
Assuming that jury duty in March doesn't impact it, but.
Great.
But I just checked my calendar and
Okay.
for the proposed dates, and I do have time.
Excellent. Thank you. Does anyone else want to jump in? And I don't know, then we'll have to get creative on who gets it. Go ahead.
I want to ask, you say you have time. Do you want to do this? Is this something that excites you?
I'm kind of a data junkie, so.
Okay. I just wasn't sure, like, you were like, I have time, but if you were like, this is only sort of
Yeah,
interesting.
Yeah, being kind of a data junkie,
Right.
engineer.
Right,
Okay.
right.
I tend
No,
to
that's
get into
good. That's
data.
good. I just wanted to clarify. Thanks.
Yeah.
I'm good with that.
Commissioner Nelson?
First, I'll go with my question. I want to, come back to the funding. Is that it's state funded, and is it they have their own chronic disease initiative that this is coming from, and we just happen to align, or I'm surprised, pleasantly.
It's a good question. So we were eligible for this pilot funding because we already have a tobacco prevention grant, which is funded through Amendment 35, which is cigarette tax dollars, and then Prop EE, which is nicotine tax dollars. Amendment 35, there isn't a whole lot of flexibility. Those funds have to be used on tobacco prevention efforts specifically. Prop EE is what is funding this, and gives a lot more flexibility in what can be covered. And so, I mean, I know we were super pleased to hear that we were going to be able to focus on something other than tobacco. Love tobacco. I worked in tobacco for 10 years, but all the funding can't
Wait,
go to.
you love tobacco?
Well, tobacco prevention. Thank you.
Strike that from the record, please.
Thank you. Good clarification. Tobacco prevention. I mean, I worked in the program for 10 years, so it's very important work. It's still a huge problem. But there's so many other things that we need to tackle. And so it's just such a great opportunity that the Prop EE funds are more flexible, and they're nicotine tax dollars, state dollars. The funding, it's a 3-year funding cycle, just like tobacco prevention. So we should expect to receive that every year for 3 years. So, yeah.
Great.
And then I'll say that I am very excited about this work too, and if there needs to be like an alternate or something, I would be happy to step in. But I also know I have a lot on my plate, but I mean, this work sounds incredibly exciting, and I would be excited to be a part of it as well, if any capacity, if it's just even counseling with one of the other people, hey, I kind of need someone to bounce this off of in addition to my other teammate here. And so be happy to participate, because this, I keep using the word exciting, but that's how I feel.
Deanne, did you want to add something?
Yes, and if I could just add, as Daisha mentioned, with the implementation funds, that follows the state fiscal year. So we will be back before the board in probably June to discuss your approval for this second stage of funding. So part of having the board liaisons work with us during this planning phase also supports that when we move into implementation and come before you for approval of that funding, that board members have context and understanding of what we've been working on together. So I appreciate the willingness to serve as liaisons, so that when we come to implementation, we're ready to move forward together.
Great. Go ahead, Ms. Ralston.
So is there there's a good possibility then that we'll continue to receive state funding after the 3 years, initial 3 years, because it takes a while to get results and to implement and evaluate and all of that. And then is there a likelihood, since it's kind of a national priority also, that we would get some federal funds?
That I can't speak to. But, given that this is built in alignment with the tobacco framework and how tobacco prevention has worked and the funding has worked. It's been historically funding that we can count on. And so I would anticipate that this would be the same, barring anything at the state.
Anything else? Okay, so a couple things. One, we'll officially appoint Commissioner Geithner and Mayor Dixon as the primary board liaisons. And then please keep us, the whole board,
Yeah.
up to speed on if either of you can't make a session. I would also love to be an alternate. So just make sure we're all up to speed on that. And then just the second thing as a reminder, it doesn't replace the board, right? This is in response to, we all are very excited and interested in this topic. There has been a desire for more board involvement with staff. So
Absolutely.
I fully expect us to continue discussing this topic and the work during these meetings.
Absolutely. We're happy to
Great.
come provide updates anytime.
Okay. Okay,
Thank you
I think
so
we're good. Thank you,
much.
Disha. All right. We will now move into executive session. We have 2 agenda items today, and I will turn it over to County Attorney Lori Seago to read us into the motion, please.
Thank you. So I will read the 2 items into the record, and then we do need a motion and a second and an individual voice vote, a 2/3 majority to go into executive session, after which we'll take a short recess to set that up. So there are 2 executive session requests on your agenda today. The first is an executive session pursuant to CRS 24-64024B for the purpose of receiving legal advice on updates to the on-site wastewater treatment systems regulations. The second is an executive session pursuant to CRS sections 24-64024B and F for a conference with the county attorney's office for the purposes of receiving legal advice on specific legal questions pertaining to the recruitment and hiring of a public health director, and to discuss personnel matters not specific to any individual employee concerning the recruitment and hiring of a public health director.
Thank you. Is there a motion to that effect?
Mayor Dixon, I'll move we go into executive session for the above stated reasons.
Thank you. Is there a second?
I'll second.
Commissioner Geithner seconds. All in favor? We'll do a roll call vote. And I'll just, we'll go down the way. If you could just introduce yourself and give us your vote, please.
Rick Vu, vote yes. Can I just have a question, though? What are the general reasons why we would go into an executive session?
The board is never required to go into an executive session. Executive sessions are exceptions to the open meetings law that allows the board to discuss sensitive or confidential matters outside of the public view. So if the board chooses to, and that's why we take a vote, it gives you an opportunity, for example, as we have here, to discuss confidential attorney-client matters with your counsel. It gives you an opportunity to discuss negotiation strategies on matters that are subject to negotiations. Gives you an opportunity to discuss sensitive personnel matters, things like that.
Thank you. Just want to clarify my understanding. Executive sessions are recorded, but not public, correct?
Most are recorded. Typically, we do not record the attorney-client. Those executive sessions that are purely for legal advice, such as the first one that's on your agenda today.
Thank you. So attorney would be you and client would be the board.
Correct.
Thank you.
And Dr. Fu, that's what I was going to reiterate. There was appetite last month. We were getting into the legal questions, and this is in response specifically to that. So that's what we're going to focus on today.
Thank you.
Yep.
Thank you. Yes,
Okay.
please.
Thank you. Commissioner Geithner, go ahead and pick us up.
Aye.
Mayor Dixon, aye.
Doris Ralston, aye.
Vice President Salt, aye.
President Barnett, aye.
Board Member Donaldson, aye.
Commissioner Nelson, aye.
And Dr. Chan online?
Aye.
Motion passes unanimously. I will call a short recess right now. Please get the room ready. Thank you.